But also, if you look at the beginning, the possibility, the disappointment, the loss, the struggle, and the success, it's also telling that story to your executives and those people you're dealing with. If it's all good, they don't remember it. It's what are the ramifications? Telling the story about the past and where the future is going to go. And that's what's remembered more. And that's one of the reasons that I show this story, is that part of it's bad. People are okay with bad fortune. But the purpose of a proposal is how do you align for where you want to take that organization in the future. So again, this is a good example of you got to be realistic, but also where's the proposal and what's the thought process for the future. So from key takeaways perspective, one, and I talked about this earlier, it's important changes happen. As I talked about, ACA, it's probably not going to last, but what it's going to be in the future, who knows? But what we do know is it's going to change. And there's going to be government mandates and organization changes. How healthcare systems are going to compensate the physicians is up for grabs. Secondly, the importance of communications given VP approval. And again, this is decision makers. The importance of pictures to explain the story. I had a CFO I dealt with, and he communicated to his director of facilities, we need to present to our corporate allocation committee. And he said, we got 20 minutes and 10 minutes of questions and answer. He goes, I want it to look like USA Today. Now for those who look at USA Today, it's all about infographics. That's what he wanted. He wanted to tell the story. And by the way, they got approval. The director of facilities made the proposal. It went through 4 more committees in the organization, of which the CFO had to present that information. Just to give you a perspective. The importance of aligning your recommendation to hospital's core offering. The importance of giving executives alternates. Again, people don't want just one option. They want a number of things. You need to understand the money and the recommendation as financing and savings are integral. You got to figure out how it's going to get paid for. A lot of times, I was dealing with a corporate director of facilities. He said, oh, we only use cash for it. We met with the CEO. First question is, you guys, financing is an option of this, right? Why was there a disconnect? Because the corporate director of facilities was told we only use cash. The CEO was looking at, again, we have good credit. Why would I not go to the marketplace and potentially get some of that money? Executives rarely visit the plant. We talked about that, the 50% factor, and thus need reinforced why it's important. You have to align to the business in those areas, especially no matter what you're doing. And more importantly, by telling the story in one pager, this is the opportunity to make that director of facilities a hero. And that's a really important piece. It's giving them the ammunition, or working with them, giving them the ammunition if you're a director of an area, so that that story can be told, but also so all those 6 departments can understand it. They don't understand technical stuff. They definitely don't understand necessarily medical stuff, but you got to put in their language how it aligns to them. So with that, John. Any questions? Or I'm here if you have things afterwards. Thank you.
Thank you.